A 30-year-old man comes in with 6-month history of cough and weight loss. He says that he's an immigrant and doesn't go to the doctor. Sputum stain shows acid-fast bacilli. He is given 4 drugs for 9 months. What vitamin should be supplemented with these drugs? So is it vitamin B3, vitamin B5, vitamin B6, or vitamin B12? I'll let you answer the question, and then I'll explain in 5 seconds. Okay, so it's going to be C, vitamin B6. So vitamin B6, so essentially for this patient, we have tuberculosis. And so you're going to give them the 4 drugs for active tuberculosis. But the main one for this problem is going to be focusing on isoniazid. And so isoniazid, its mechanism of action is decreasing mycolic acid synthesis. And so one of its side effects is actually neurotoxicity, but this can easily be prevented by giving vitamin B6. And so this is also known as pyridoxine. And so the risk factors for getting tuberculosis are going to be immigrants, and it's also going to be people that have long exposure in prisons. And just going over the other answer choices, we're going to talk about vitamin B3, which is niacin. So when you have a deficiency of niacin, you're going to have the 3 Ds, which is going to be dermatitis, diarrhea, and dementia. And then the other one's going to be vitamin B5, so that's pantothenate. And so this one's also going to have dermatitis, just like the previous one, but it's also going to have enteritis and alopecia. And for the final one, vitamin B12, cobalamin. So this one's going to have a megaloblastic anemia. So you're going to see an MCV greater than 100. And then you're also going to have neurological dysfunction. And just a reminder that B12 in the liver lasts for years. But this patient doesn't really have that. And so you would typically see this for someone that's changed their diet and then they've been that way for many, many years, because B12 lasts a long time versus folate, which actually has a shorter time span, and you don't hold as much folate as you do vitamin B12. So for this one, just to summarize, the risk factor here is that he's an immigrant, so you start thinking, especially with the cough and weight loss, that it could be TB, and then this really confirms it with the sputum stain that shows acid fast. And then the main thing here is knowing the treatment for it and understanding that one of the treatments, which is isoniazid, needs to be supplemented with vitamin B6. So I hope that helped, and thanks for watching.